The ACEP Conference is important because it brings together more than 7,000 providers of emergency medical care who then have the opportunity to learn best practices, to learn the latest and the greatest in terms of giving superb service and quality outcomes to our patients, and who have the opportunity to network and learn from each other. When I first started practicing emergency medicine in the late 1970s, there were no emergency medicine specialists. So if a person went to an emergency department, they might see a doctor who was a ENT, ear, nose, and throat specialist, who was waiting for his practice to build up. Now, when members of our community come to an emergency department, they can have the confidence that they are being seen by a physician who has been specially trained in emergency medicine. They can expect high quality, compassionate care. The emergency department was the window to the community. Then we became the door to the hospital, and we now know that in most cases, over 60% of patients admitted to the hospital come through the emergency department. At the same time, we know the importance of primary care. And so we are now seeing ourselves in the emergency department not just as the door to the hospital, but as the porch of the medical neighborhood. We are part of the acute care continuum, from the doctor's office to the emergency department, and then back to the clinic or back to the doctor's office. And so how we transition the information and the care that we've given to patients to the next provider is crucially important.
It's not all positive. With growth and an evolving system, there is stress on the emergency medicine system and the people that provide the care.
Department, because our hospitals do not have the capacity to rapidly and efficiently take in patients who we as emergency physicians feel need admission into the hospital.
As more pressure is placed on emergency services and the system in general, more people are turning to the emergency department for their care. The benefit is that the emergency department allows complex workups for acute conditions to be completed in a compressed time frame that cannot be achieved in most other settings.
Patients benefit from coming to an efficient emergency department because we can get done in 3 to 5 hours what it would take their primary care doctors or other specialists could be a week to 2 weeks to get done. When people come in with a complaint, we have the availability of all specialties. We have the availability of all imaging and diagnostic laboratory testing at our fingertips. And so we can apply that to the problem the patient brings to us, and in most circumstances get them an answer within a period of several hours. Sometimes the answer is, we don't quite know what you have, but we know it's nothing life-threatening or serious, so you can relax about it, and in time the diagnosis will become more apparent.
This growth and expansion of emergency medicine has strained the hospitals, departments, and physicians. Recent surveys have demonstrated that nearly 2/3 of emergency physicians have some level of burnout, and over half qualify as having PTSD. That is why ACEP and Dr. Kaplan are making a huge push for physician health and wellness.
It's important to focus on the wellness as well as the care of our patients for several reasons. One is there is pretty good evidence now that physicians who are burned out do not deliver the same level of quality and caring that we'd like to give to all of our patients. And so I like to think about it that unhappy doctors and nurses don't make for happy patients. And so we have to simultaneously focus on creating a great place for patients to come for care at the same time that we focus on creating a great place for doctors and nurses to practice medicine.
He summarizes this with a motto that he uses with his wife and now applies to emergency medicine.
So the line that my wife and I agreed on was, I'll take care of me for you if you'll take care of you for me. Physicians are not terribly good at recognizing burnout in themselves. And if we begin to connect the dots and we begin to see that if we take care of ourselves, then the personal side of our lives go much better. And then the care that we give to our patients in our work environment goes much better. So wellness and developing resilience in ourselves as emergency physicians is crucially important, not only to us and to our families, it's also crucially important to our patients.